Is your nose constantly congested? Are your lips very dry all the time? If so, then this video is for you. Hi, I'm Dr. Stephen Park, ENT surgeon and sleep medicine physician, and author of the Amazon bestseller Sleep Interrupted, a physician reveals the #1 reason why so many of us are sick and tired. If you search the internet, there are literally hundreds of different suggestions on how to get rid of a stuffy nose. In my last video, I went over 7 natural ways to clear your nose. In this video, I'll reveal 5 unnatural ways you can have clear nasal breathing. Number 1. Nasal decongestant sprays and pills. Over-the-counter nasal decongestant sprays such as phenylephrine or oxymetazoline are probably some of the most commonly used treatments for people with stuffy noses. Some of the more common brand names you'll see are Afrin and Dristan. These medications constrict blood vessels inside your nose, and the result can be relatively quick and dramatic, but the effect lasts shorter and shorter the longer you use it. This is why it's important not to use these products for more than 3 to 5 days. Many people become addicted to these sprays, leading to what's called rhinitis medicamentosa. If you're addicted, then you have to see an ENT doctor who can help you wean off this drug. You can also take any of the variations of decongestants in pill form. These come with or without an antihistamine. But you have to be careful since these pills can raise your blood pressure. And some people are very sensitive to these pills since they can cause your heart to race or you'll feel a little jittery with problems falling asleep. Number 2 is cocaine. This is a powerful decongestant as well as an anesthetic. Using cocaine in the nose over time can cause a hole in the septum, not to mention a bad drug addiction. Many famous people were cocaine addicts, including Sigmund Freud, Thomas Edison, Michael Jackson, Frank Sinatra, and Whitney Houston. Number 3 are nasal dilator devices. These are devices or gadgets to spread your nostrils apart, and the most well-known options are called breathe right strips, but there are also dozens of other options that go inside or outside the nose to keep the nostrils from caving in. Number 4 is palatal expansion. This method may be a surprise to you, but dentists and orthodontists will tell you that if you have narrow jaws, which most of you do, using an expander to widen your upper palate can also improve your nasal breathing as well. When you expand the upper jaws, you're also widening your nasal sidewalls. And number 5 is surgery. This option is definitely unnatural, but sometimes absolutely needed. There are many different reasons for nasal congestion, and only a qualified ENT doctor can tell you what options you have. I've talked extensively about nasal surgery in a past podcast, and I'll place a link to the podcast below. Note that the first 2 options constrict not only your nasal blood vessels, they also constrict your body's vessels, and because of this, they can raise your blood pressure as well. And on the flip side, many medications that lower blood pressure can also cause nasal congestion. Sildenafil, also known as Viagra, relaxes blood vessels in men's penises, making it erect, as well as the nasal turbinates. The nasal turbinates and penis both are made of erectile tissues, which swell when the blood vessels are relaxed. These side effects are common and very well documented in the medical literature. And just to be clear, I'm not saying that something being unnatural is a bad thing. Well, cocaine may be a bad thing. However, most modern humans have bony and structural reasons for nasal congestion, and your typical conservative or prescription medications may not work. These are the people who need devices, appliances, or even surgery. In my next video, I'll reveal 5 reasons why fixing your deviated septum may not work. If you found this video helpful, please subscribe and press the thumbs up button so that more people can find this information. Please leave your comments below and tell me which one of these 5 areas you tried already. Did it work for you? I'd like to know.